Dr. Corin Voss lunged forward, a cry tearing from his throat as the canvas walls trembled with the roar of distant guns. The field hospital tent sagged under the weight of smoke, mud, and the iron tang of blood that never entirely left the air. He jammed his remaining hand against the frame to steady himself, the other still pinned beneath a fallen, splintered wheel. The arm, a field-bound casualty of his own stubborn hands and the war's iron laws, was crushed, mangled, a trap of bone and sinew that no reduction of pain could fix with a single breath. The night outside pressed in. Lantern light wobbled on the copper blade of a surgeon's knife, catching the glint of dried blood on the shelf, where bandages and salves waited like patient soldiers. He looked at the makeshift table, an old tin plate repurposed as a tray, a few clamps, a length of twine, a pocket listle of a weapon for emergencies rather than for shooting. The air tasted of iron smoke and ground wheat, with a whisper of sour whiskey from the small flask tucked beneath his sleeve. He could hear the soft, irregular heartbeat of the tent fabric, the distant clack of boots on earth, the soft rasp of a soldier's bed creaking as someone shifted in pain across the aisle. The moment pressed into his mind with the insistence of a drumbeat. The surgeon's eyes found a small warped shaving mirror propped against the edge of the tray. It reflected the pale, steady glare of the lantern overhead, the blurred shape of his own pale face, and the workbench behind him, a line of surgical tools arranged with as much ceremony as a priest would arrange holy relics. He pressed his teeth together and drew a slow breath that rattled in his chest. A breath that tasted of old copper and bitter iron. The plan came to him in fragments. Then, in a singular, merciless clarity, there would be no anesthesia. There would be no waiting for some distant medic to fetch a drug from a shelf that might risk being discovered by a drill sergeant's eye. He would do it quickly, as the grim calculus of a battlefield dictates, 4 minutes of focused, ruthless action, guided by the mirror, the tremor of his own hand, and the cold knowledge that life could hinge on the edge of a blade. The face in the mirror did not blink. It studied the arm trapped beneath the wheel with a clinical coolness born not of courage but of necessity, the same tone that whiskey gives to a man who has faced too many dawns. The skin around the injury bore the blush of crushed tissue, the way ripe fruit reddens when pressure is applied. The metal's rosette of dented spokes lay across the forearm. A small rivet of steam rose from a seam where the leg of the wheel had ground down bone and sinew into a stubborn, jagged maze. He could hear the soft sizzle of hot iron in some distant forge, perhaps a blacksmith's shop miles away, or maybe the iron drum of a distant artillery piece reheating after a distant assault. The smell of oil, damp leather, and disinfectant hung in the air like a heavy curtain. He spoke to himself, a careful whisper that could be mistaken for a prayer if anyone were listening, which they were not. "This is the only way," he said to the reflection, to the shined metal, to the empty room that would one day be a story told in relief. No sedative will quiet the bone or soothe the nerve. 4 minutes, 4 little minutes. His left hand trembled with a life of its own, the fingers curling and uncurling as if they remembered a habit long since broken. The right hand, his working hand, rested on the edge of the blade, the steel cool against his skin, the blade's edge catching the lantern flame and throwing a thin, dangerous line across his knuckles. He flexed his grip, the pressure forcing a tremor into the air that tasted of copper and fear. He drew a quick, steady breath, counting the beats of his heart, listening to the subtle hiss of the tense breath as it exhaled and inhaled with him. "Begin," he told himself. And with that single word, the mirror became not a mirror, but a window into a different world. The cold, clinical world of a man who would not be paralyzed by the pain of removal. He spoke aloud again, a cautious, practical whisper, as if to a confidant who would merely observe and not judge. No anesthetic. You know the anatomy, you know the tools, you know your own body's limits. The air grew sharp as a blade, the texture of the tense canvas under his sleeve turning to a scratchy, honest sound. The plan unfolded in steps, each precise, each necessary. He loosened the belts that pressed too firmly on his chest and torso, the leather cracking with a dry sigh, as if relieved to be rid of the extra weight. He applied a crude tourniquet, no sterile cotton, just a strip of linen torn from a clean cloth and wrapped tightly around his upper arm. The pressure bit into his skin. He could feel the pulse hum under the skin, a stubborn drumbeat insisting on life. He knew he could not rely on the tourniquet to stop all bleeding, only to slow it until the procedure ended. With the mirror in front of him, he studied the limb as though it belonged to another man entirely, the arm that had saved him more times than he could count. Now a liability in a moment he could not refuse. He adjusted the lamp so the light cut cleanly across the arm, the shadows narrowing as he focused on the plan. The blade gleamed with a cold promise. He turned his gaze away from his own eyes in the glass, and toward the arc of the tool's blade. Steady, unbending, inexorable. The first cut was a whisper, a sigh of steel that found the skin at the edge of the forearm. The pain lanced through him in a bright flash, not unlike the crack of a rifle ball going through bone, the world narrowing to a tunnel lit by the lantern flame and the cold silver line of the steel. He did not flinch. He did not allow fear to pull him away. The second cut followed quickly, a clean, clinical bite that loosened the flesh from the bone, the cloth of his sleeve turning red as the blood seeped into it, a slowly spreading red map on his skin. The smell grew thick, more metallic, more present, a coppery sweetness that filled his nostrils and curled into his throat. He spoke again, to the empty tent and the clamp of his own jaw. 4 minutes, he said, counting in his head, listening to the rhythm of his breathing, the soft rattle of the tent's support poles, the distant thunder of artillery somewhere beyond the trees. Each breath he took came with a sharp, prickling burn, a line of heat racing along the nerve endings that would soon be absent. The blood pooled at the edge of his vision, the world blurring at the periphery of his focus. The mirror's reflection narrowed, the face of the surgeon steady, the eyes observant, the mouth set in determined lines. The tool's teeth moved against bone, a final, necessary act. He took another measured breath. The air tasted of iron and soap and something less definable, an odor that reminded him of the first time he had ever laid hands upon a patient, years ago, when hope was a simpler thing and fear had not yet learned to whisper permanently in his ear. He pressed the blade deeper, drawing it along the contour of the radius and ulna, as if tracing a careful map. The world erupted in white heat for a moment, the sting, the flash, the thunder of the gun outside, the body's reflex that threatens to throw one off balance, to make the surgeon falter. He did not. The moment came in a small, dreadful clarity. The arm was severed. He could feel the resistance give way, could sense the last tremor of the bone, could hear the faint, wet kiss of blood as it spoke its last word on the blade's edge. The nerve endings, no longer able to shield him, sent a last stinging wave of pain across his chest, then, mercifully, a moment of dull, almost tolerable numbness, as the blood loss began to settle into a rhythm his body could bear. The 4-minute countdown had its final tick, and with it a new silence pressed into the air, heavier than the drum of artillery. The cut's edge glinted in the half-light. The arm hung there for a breath's length, an unnatural burden, a heavy missing piece of him that had kept him whole through too many winters on the edge of history. He reached with the gloved hand that lay over the blade's handle and steadied the saved portion, inspecting to ensure no jagged fragments of bone could tear through the delicate tissue of residual nerves, no spur of bone to catch on the wound's edges. The tourniquet pressed, the pain dulled to a gnawing ache, the body's anger shifting into a stubborn relief that he could truly do this, that the arm was no longer beyond his control, but a body's surrender accepted with resolute grace. He laid the severed limb aside, the cloth around his upper arm slick with blood and sweat, the air now thick with an electrical hum of fear and a stubborn sense of relief. His breathing slowed to a more measured cadence, a rhythm not quite steady, but enough to carry him through whatever came next. He looked back into the mirror, the reflection of his eyes meeting his own gaze in a way that almost felt like recognition, a silent acknowledgement that the man who stood there in the glass was not the man who began this night, but the man who would live to tell the tale on a different battlefield. The moment of quiet was short. The nurse, a careful, practical creature of habit more than sentiment, once hovered at the tent's opening with a lantern's glow trailing like a comet's tail. The scent of linseed oil and wool, of old soap and fear, filled the space as she stepped forward, eyes wide with a mixture of awe and horror. She did not speak for a moment, letting the room breathe with him, letting the breath of the old tent exhale the tremors from his bones. Then she whispered, soft and careful, as if afraid of breaking some fragile spell. "Is it done, Doctor?" He did not answer at once. The answer hung between them in a thick, breathy silence. The kind of moment that leaves a man tasting copper on his tongue and feeling the world tilt just slightly on its axis. When his voice finally rose, it came slow, measured, and so very tired. It is done. 4 minutes exactly. There is no anesthesia, no waiting. The rest is up to the body and the will to live. The nurse shifted her weight, the lantern's beam catching on the damp fabric of her apron, the oil on her hands making a faint, sweet smell along with the sour tang of the battlefield. What now? You'll lose more blood, she said. Her words clipped with the practical ring of one who has seen enough to know the truth of such things. He looked at her with the same calm he'd used years earlier when he had faced down a patient's panic. Eyes steady, voice quiet. I'll bind the wound as you would any other, and I'll survive the night, he said, the words carrying a stubborn resolve. Then we'll see what the morning brings. The two worked in a grim, well-practiced duet, she with bandages, he with steady hands to secure the remaining tissue and close the wound as well as the anatomy would allow. The smell of iodine and linen, the feel of rough cloth against healed skin, the soft, damp heat of the bandage sliding over sticky, uncertain tissue, all joined with the clink of a glass bottle, the soft rustle of fabric, the distant rumble of cannon. The tense air grew warmer, the heat from the lantern's flame turning the canvas to a shroud that pressed in on all sides, as if the world itself were leaning closer to whisper secrets of survival. In the slow afterglow of the procedure, Corin sat back on the wooden plank that served as a chair, letting the blood drain and the mind clear. He listened to the muffled global undertone of the battlefield outside, the creak of wood, the occasional scream of pain, the distant sound of horses and wheels. The air smelled of tallow and smoke, of disinfectant and old copper. He touched his own wrist, feeling the pulse in the forearm no longer attached to his hand, a reminder that the body could endure a disintegration and still bring forth the will to endure more. But the story of the night did not end with a single act. The war's long march pressed forward. Men would come and go, each with their own torn bodies and their own stubborn refusals to surrender to the clock. The field hospital's corridor would fill again with the clamor of boots and the sharper cry of pain. And Corin would be asked to move beyond the pain's edge, to bear another weight, to heal someone else who needed more mercy than the body could offer. The presence of one arm would change the man he had been, but what that change would mean for the living, for the dying, and for the future was not yet written. Yet that night, within the tense, uneasy shelter, he found a thread of something not entirely new, a glimmer of a truth he had known for years, but seldom allowed to speak aloud. A surgeon's duty does not end at saving a life. It loops with cruel irony into the life one must live after the blood has dried. The pain receded and the fever of fear has cooled. He would learn to live with the absence as a tool, as a constant presence, a reminder of what a man could do when faced with a choice no other man could survive. The clock on the wall, an honest, stubborn piece that had seen too many times toll, ticked on. The 4-minute window closed and reopened, a cycle of endings and beginnings the battlefield had taught him to expect. The lamp's glow remained. The mirror kept its cold witness. The smell of iron hung in the air, a permanent echo of a moment in which the human body faced its own limits and decided to push past them anyway. In the quiet minutes after the operation, when the world outside still wore the heavy boots of war and the battlefield's din sharpened every nerve, Corin's mind wandered through the corridors of memory to places only surgeons know. The early days of medical school when he believed in the certainty of scalpels and sutures, to the first time a patient's eyes widened with a spark of hope, to the moment when a single decision could spell life or death for someone who trusted him with their breath. He thought of the men who would endure this night's injuries and the women who would mend them, of the families listening to the distant thunder of cannon and praying for dawn. The night stretched, and the field hospital settled into its uneasy rhythm again. The wounded crowded in, and the living rumbled with the weight of the dying. The dead lay quiet, their silhouettes sketched by lantern light on canvas, their faces pale in the half-dark, their breath becoming a whisper in the air. Corin's left arm, now forever missing, rested in a linen sling at his side, an object lesson in the body's stubborn resilience and the mind's stubborn mercy. He did not pretend the sacrifice was simple. He did not pretend that pain would vanish or fear would vanish. He did not pretend that the world would forever honor the sacrifice it required. The morning would bring more needles and sutures, more splints and tourniquets, It would bring another round of questions, a dozen more tests to learn what the body could bear after such a night, and perhaps a few fewer questions about whether a surgeon could truly be the patient he sometimes must become. But for that night in that tent, the act had been performed, and the act itself would echo in his heart as a sign and a warning. The body is a map of every choice a person makes when the world asks of them more than they ever believed they could give. Dawn's pale light seeped through the tent's worn flaps, turning the canvas into a pale old parchment. A breeze threaded through the fibers and carried the scent of rain teased by distant thunder. The field hospital's rhythm began to resume its time-worn, improvised melody. The soft shuffle of boot leather on wood, the clink of glass vials, the quiet, careful movements of the nurse as she readied a new bandage, the cadence of someone muttering a name in hope that the thing called mercy would listen. And in those hours, Corin did not speak much, though his thoughts poured out in careful, measured conversation with those who were not there to hear. He spoke to the commander of the post in his own mind more than aloud, in a dialogue that the outside world would never hear. The necessity of a decision that cost a man his arm but saved dozens of lives, the moral weight of self-sacrifice, the line between hero and instrument, and the stubbornness of will that refuses to yield to despair. The day wore on into a harsh afternoon, and the battlefield reasserted itself with a fresh barrage, a relentless, almost rhythmic pulse of cannon, smoke, and iron. The tent shook as if a giant hand had punched from outside, dust and grit spilling through the seams to dust the floor with grit, and the patient could sense the momentary tremor in the ground beneath. Corin stood at the edge of the space, his one arm strapped against his chest with bandages and leather, his body telling him in 1,000 tiny splittings of pain that he was alive, and that the night's act, terrible as it had been, would be carried like a flag in the next day's light. He did not see his own face in a mirror again for hours, but the image remained with him, an unblinking gaze that found the room's edges, the glint of steel, the line of the blade's memory across skin and bone. He remembered the feel of the blade's edge pressing into his own flesh, the way the world had narrowed to a single point of purpose and a minute-by-minute countdown. He remembered the taste of copper on the tongue and the sense of relief when the blood finally steadied and the body yielded to mercy once again. The day wore on, the hospital's makeshift walls fluttering with the day's wind and the day's fear. The soldiers, the wounded, and the watchers who had learned to read the war as if it were a book of stubborn pain all passed through, and Corin found himself listening to their stories whenever a moment allowed. He did not indoctrinate himself in the artificial courage of others. He did not pretend his own pain was less than others. He simply walked among them, a man walking a line between two lives, one he had lived fully before the accident, and one he would live afterward, where the absence of his arm would become a new instrument, a new way to shape the world with the remaining strength that still endured. Night came again, and with it the quiet of a tent finally grown weary with too much fear and too many hands needing to fix the broken. He stood near the edge of the space where the light barely reached, the air cooler now, the scent of earth and rain creeping under the doorway. The world outside still rumbled with the war's endless pulse, but inside there was a kind of quiet respect for the man who had chosen to cut himself, to endure, to become less for the sake of more. In that quiet, the question then turned to the future, not a future that could undo the night's act, but a future shaped by it. If a man could amputate his own arm to spare another's life, what else could be done in the face of faith, duty, and fear? The spectre of his choice would linger, a stubborn, unyielding companion. The war would demand, the world would demand, and his own heart would demand too, to live, to heal, to teach what survival could truly mean when every line of one's body and all the lines of one's life were drawn together in a single, stark moment. And then, as if answering the quiet question with a slow, inexorable truth, the tent's flap shifted again and a breeze of cold, clean air washed over him. The night's quiet became a kind of promise, not of painless cure, not of perfect peace, but of continued existence, of the stubborn insistence that life, even in its simplest form, would endure. The 4-minute act had ended, and yet the 4-minute clock of the war had not. It would continue to tick in every chest that beat too long after the hope's lamp had burned low, in every life that remained to be saved, in every choice that a man could make when the world asked for more than mercy could easily give. Somewhere, Beyond the canvas and the smoke, the morning would arrive again with its own demands, its own wounds, its own possibilities. But for that night, for that man, the act stood as a testament and a warning, a reminder that even the brightest light can come from the smallest blade, and that the human spirit, when pressed to its edge, can do something terrifyingly simple. Survive, and in the moment of survival decide what it means to be human again. The night finally settled into a weary, almost tender silence, and in the distance, the guns quieted to a lullaby of distant thunder. The world outside would go on, as it always does, stubbornly obstinate, stubbornly alive. Inside, in the quiet that followed the storm, Corin's sleep came not as a dream but as a vow, one arm, one mind, one will, to keep fighting for life, for the wounded, for the memory of a night when one man did the unthinkable and kept life breathing in the spaces, where it was most needed. He slept with the certainty that a 4-minute act could alter the course of many a day, but more importantly, that a life given in service to others could be rebuilt, brick by brick, breath by breath, scar by scar, into something new and perhaps more enduring than the old. And when dawn finally came, it would bring with it the next patient, the next story, the next chance to choose again what it means to be whole in a world bent by war. Corin would face that dawn with the same steady gaze, with the same patient, stubborn sense of purpose. The memory of the blade, the mirror, and the 4-minute window would remain a line in his bones, a constant reminder that the act of saving a life sometimes must begin with the most brutal act of surrender, and that surrender, so long as it is chosen